left lateral rectum first. Yep. So true lateral position. We're going to use a 10 by 12.
And bring your shoulders back toward, no, straight. Good. Bring them back.
Yeah.
Like that.
Straight.
I'll let Randy do it.
I feel like I'm not straight.
You're not.
Alright, so what
Your
marker
hips
are we
need to
gonna
go in.
use?
Yeah, your hips need to move forward a little bit.
Yeah, bring your hips forward.
Yeah, just bring your bottom
We're
forward.
gonna use left marker.
Like that.
Okay.
Now it's probably too much. Did
Yeah,
we get
it's
too
too
much?
much now.
So just.
That's good.
Yes.
That looks good.
It threw me off last week.
We have
I
this.
was on.
Alright, so for this one, you can mark either way. You can mark up top or down below. It's really not going to matter. This one, we are going to keep the collimation wide open. Okay, so we're going to utilize all of that 10 below.
Really, the only one you're collimating on is on the sigmoids. If you don't have the 11 by 14, and you have to use a 14 by 17.
Alright, so we want to be at ACES and MCP.
For your aces, isn't it? Okay, this is the crest, but isn't this
Yep.
whole thing the aces?
No, the ACES is just the little bony part that sticks out.
Okay. Because that looks like your crest at the top.
Anterior,
This is your-
superior,
Iliac
iliac
spine.
spine.
I feel mine.
No.
It's like covered in soft tissue.
Here we go.
Don't say
Yeah,
that.
mine too. Mine is
She
too.
feel like she got a lot
Here
of
you go.
layer on. Oh, so find the bony. Okay.
Yeah, so a good way to do is find the crest and follow it down until you
Right.
kind of feel a little point.
Yeah.
Something's still not right.
What's that?
Exposure hold on it.
Oh, it's gonna be like, if you're at 40.6, it's gonna give you that. Okay, so are we at the ACES?
Yes.
Yep. Okay.
Aces.
Maybe push forward a little bit.
Mid.
Yeah, you want to make sure you do it.
There we go. So we might be just a little posterior to
MCP.
a little posterior to MCP. But don't let soft tissue fool you, because we don't want to be like all the way, shooting all the way back here. Just because you see a lot of, not to say that you have a lot of soft tissue back there. But if you see somebody with a lot of soft tissue, don't let that fool you, because it is still a midline structure here, because their bowels aren't going to be, or their rectum's not going to be out all the way this way. Does that
So
make
it's
sense?
kind
But
of
that's
where
not
your
how
light
it
is
is.
now.
No, I think it needs to come
Yeah, right
like
there.
right there.
Yep.
Okay. So they do say that the bottom of the cassette should kind of line up with gluteal fold, which it pretty much does. Or top of the cassette at crest. A lot of people do that too. Okay. All right, lateral rectum. Looks good. Looks good. Looks good. All right. So ventral decubitus rectum. So she's gonna be on her stomach. And I think that.
How are the hands? Was it just up?
Yeah, it doesn't matter.
Okay.
So we're gonna use the grid for
Bring
this
your
one.
hips. Bring your whole body toward me. There you go.
So, and I think the only cassette, we're still gonna use a 2 by 12.
Usually with the floor table.
No, not this one.
Not this one, you're on a floor
Yeah.
table, so
She's gonna
runners
have to
have to
kind of lay on
protect.
that.
This 10 by 12 does not fit that.
Just do it.
Oh, let's do the 10 by 12.
Oh, you want to do the 10 by
Yeah.
12?
This cassette does not fit in there. Just
Yeah, we'll just use the grid.
We'll pretend.
Pretend there's a cassette.
okay.
Do you know what grid the digital rooms go off of at Norfolk? Like what the grid ratio is?
It has a low grid ratio. I do know that.
Okay.
We made up a number at ours.
It should tell you on the grid.
Okay.
Does it not?
It normally just says distance.
Was it like a 10 to 1 or something like that? It's not like a low
10 to 1 or 12 to 1 is normally like standard now, I guess.
Alright, so we want a horizontal beam.
Horizontal. Is this where I would drop it 90 and then turn it?
Yeah, so bring the tube towards you
Bring it
first.
out.
Take it out of D10. Let's put it on the tabletop too. So bring it towards you. Alright, so now you're gonna turn it this way. So we're gonna use this.
Bring it out some more.
You can turn it towards you. Alright, so now you wanna pull it back towards you a little bit. It might make it easier. Just pull a little too. Yeah. Keep going. And then now you can swing it more because you want this to be like 90 degrees. Close good. So now you can flip the tube. So this, when you're doing this, it might be easier to use the all release handle. Okay. So the easiest way to do
Unwrap
this.
it all the way up.
The easiest way to do this is to put your cassette where you want it first. Alright, so then all you have to do is line up to your tube here. So, you know, if we want to use, for this one it might be easier to do top of the film at crest or, you know, however you want to do that. So I think this looks good.
Top
Sure,
of the
your
film.
grid isn't tilted.
Yeah, that's important. You want to make sure that this isn't tilted here because if so, you're going to have some grid cut off, okay? So you want to make sure that you're lined up to your grid. Can you see the light? Like keep your light open so you can see like where you're lined up first. Alright, so can you see that you're lined to the center?
Come back this way. Alright, that's better.
Sorry.
Nice.
That's center.
I'm just gonna like okay.
Push the beauty there.
So if this is her line, if this is the central right here, so we're pretty good.
Should we still measure for 40?
Yeah, we want to be at 40 inches.
Look, it's a little too.
So you're gonna have to bring it
Bring
up
it
a little
out.
bit.
Okay.
Yeah.
Bring the
The
tube.
width of the table is close to 40 inches.
So-
But remember, see, we're in
Yeah.
about 6 inches, so you want the front of that to come out more.
Is that 40?
Yep.
Okay. So now drop it back down. Okay, so you want to kind of be along the MCP here. You want to make sure that you have light,
Here's the light.
but we don't want light on
On the wall.
the wall, so bring it in.
Smidge.
So that's good here, but bring it in side to side. Okay,
That's good.
that looks good. All right, so we're gonna use a left marker, or I'm sorry, we're gonna use a right marker on this one because her right side is closest to the image receptor. Make sense? Okay, so we can put a marker here. We can put it here, wherever you want to put it. Okay. All right, and what's our technique for this?
90 and 100.
90 out of 100. Because this is going to be for the single or the double?
Double.
Right, okay. All right, good. Any questions about the rectum? All right, what's next? Just obliques?
Right.
All right. Do you guys want to switch it up and...
Yeah, let's switch.
All right, who wants to do...
Do you want me to move this over? No, okay. Just push it that way.
So what Cheryl was saying earlier, no, when you guys go back into your floor rooms, see and look if there's like, there usually is a little lip that you can put your cassette on. It's where the Bucky tray is. You just slide in between there and that's usually what holds it up. Okay. Who wants to be patient? Who wants to be tech?
Guess I'll be patient again.
I'll tack. Right? Let's move it. We're going right lateral.
Okay.
So right side down.
So right now.
So
do we
hands
just
in
want
like a
her-
prayer position here. That's good.
We just want her centered, right?
Yep.
Centered in the table, or we want her
Well,
back up on this?
We want her in a true lateral position first. Okay.
Not bent forward or back, and
I like your
she
bending.
have forward.
There you go. Okay. So we're doing a right lateral, so we're demonstrating the left side, so we might want to be a little higher than the crest, but she's so tiny it might not really matter here. It's not going to matter at all, actually. But we can center just a hair higher. We want this to be as close to the patient as possible. Same thing with the ventral. Okay, so this is right up against her. Looks
So we
good.
want the center of this the center of her crest.
So
I mean, at her crest.
at the crest, but ideally
For
an
her,
inch
yeah.
to higher. But for her, we do want to be at crest. Okay,
She's
so
so little.
so does that look like the center? Is where the crest is?
There's her crest.
So pretty
Yeah.
much everybody
Yeah.
else.
It's good.
Everybody else in the room 2 inches above.
Just judge your patient's
And
body
again,
habits.
this is one where you're gonna have looked at the fluoro, and you'll know how high you need to go up.
Use all release.
If their
I don't like all
flexures
these.
are pretty close
It
to the
messes
same
you
level,
completely up.
You will have to get used to it and make
Wow.
your life so much easier. Okay, so that looks good. So we want to bring it down to
Why
where.
does this thing look
That's what I was thinking.
no,
Yeah, it
it's
is a little
tilted.
crooked.
so bring it down?
It's tilted now.
Yeah, you just tilt.
Wait, hold on.
It looks on the grid. It looks
Yeah, it's crooked.
There you go.
Yeah, like that. Now it's flat.
okay. Where am I bringing it
So
down?
you want to be down to MSP,
Oh.
and we want to open up the light. Okay, so for her, we can actually have a little bit of collimation on here, but for most, you're going to keep it wide open.
Mm-hmm.
How much from the other side do we
That's
need?
good. So you can see you have a little bit of light on the table here.
Mhm.
Okay, so that's how you know that you're going to get some of the downside also.
Isn't that too much light?
Yeah, what is your
Okay.
where are you at? No, yeah, because she's 16
Because I have light
by
here.
50.
I'm too
She's
good.
almost like 17 by 16 on this one. So
Are we at
no,
exactly 40 inches?
they
Where's the
didn't
tube?
move it, so it should still be.
I didn't move this time.
Yeah, we're at 40.
Yeah, 40. Okay,
It's
then you
just
can bring it in.
wider.
Just over there.
Just look at your numbers.
So just remember the 14 by 17 field size, that's only going to be completely accurate if you're at like 40 inches. So, so you want to make sure of that.
I think that's better.
Yeah, that looks better.
Yeah.
That does look better. Okay. So left marker down here.
Yeah.
Okay.
Mm.
You get the drift.
You know what I'm saying.
No, I'm saying.
Nasa?
Nah, me.
Nasa?
All right, make sure this isn't correct. All right, so now if you're gonna do your left, all you have to do is you're gonna flip over, you're gonna lay on your left side. Okay, make sure that they're pressed all the way up against this here. So scoop forward, scoop forward, scoop forward. Okay, so nothing should really have to change much from
Bring
here.
the shoulder
You
up a
might
little.
wanna-
Yeah, roll it back.
Rotate her head back. There you go. Yeah, and instead of moving everything, because like we were a little bit, well, actually, we weren't high, but if you had gone high, you don't have to necessarily change anything. Just float your table so that you're back at crest.
Oh,
if
yeah.
you went higher on that other one. Okay, so you don't have to touch anything. You're just gonna float your table once they.
She's good.
Looks good. So then right marker down here.
We have all this light here, though. You wouldn't put the marker up here?
Well,
Because
you
she
can.
has, everybody won't have that, but she has that.
For her, you can, but I wouldn't make it a habit
Okay.
because once you start that, then you're just
Your brain's gonna auto.
Yeah, I would just
Remember
always
that,
get in the
yeah,
habit
area of
putting it
interest
down.
on these ones is up at that flexure, so you didn't want to risk anything.
But you could
mean-
if you wanted to.
If it's blatant like this, yeah, but a habit, if you want to get into good habits, put it down farther.
Yeah, for me, I'm very repetitious, so I always
Yeah.
put marker in the same exact spot every
you don't
time
have
for
to
each
think
exam.
about it. Yeah,
Yeah.
it becomes like kind of like muscle memory.
It's like I don't know what happened. I just threw my marker in it.
But these decubitus, you didn't want to
Side up. Yeah.
Mm-hmm.
That's what gets confusing.
Well, it's because the cubes are really like they're just turned up. It's not a lateral. They're not lateral. So even though she's in a lateral position, it's not a lateral image because of the way the tube is coming at you. It's like a PA or an AP. All right.
Okay.
So that's
Makes
the
sense.
difference,
Yeah.
right?
Yeah, that does help if you think about it that way.
And those are both double.
Yes.
What about for the left lateral rectum VE? Is that a single? Because I have single contrast only on that one.
Typically, it would be just a single.
Okay.
Yeah.
Which one?
The left lateral rectum.
Oh. It could be both though, right?
Typically, it's only a single.
Yeah.
Okay.
Because if you're doing the double, typically you would do that cross table ventral
Ah.
decubitus.
For the air fluid.
All right, guys, this is the last class of the fall semester of Shorty 16. Hey. Okay, now it's done.